Here's a story for you. It's a dark and stormy night in America, and a shadowy figure is bleeding the nation dry. This isn't a villain from a cheap horror movie. No, according to the MAGA narrative machine, this villain is an undocumented immigrant, and they're coming for your health care. The claim, blasted across conservative media and echoed in the halls of Congress, is as simple as it is terrifying. 1.4 million undocumented immigrants are illegally siphoning funds from Medicaid, a program meant for vulnerable Americans. This accusation is the very foundation upon which H.R. 1, the so-called One Big Beautiful Bill Act, has been built, sold to the public as a necessary measure to protect our precious resources from foreign invaders. They paint a vivid picture, don't they? They want you to imagine hordes of people sneaking across the border not for safety or a better life, but with a Medicaid card already in hand. It's a narrative of criminality and exploitation. Proponents of H.R. 1 stand at podiums, their faces grim with faux concern, and declare they are simply closing a loophole. They insist they are patriots, bravely defending the American taxpayer from a tidal wave of fraud. This image is powerful. It's emotionally charged. It transforms a complex issue of healthcare policy into a simple tale of us versus them, good versus evil, citizen versus illegal. And it's the perfect justification for what comes next. Brutal, sweeping cuts to a vital public service. This carefully constructed narrative serves a singular, cynical purpose. It's designed to provoke outrage and stoke fear, creating a public mandate for a policy that would otherwise be deeply unpopular. By framing the debate around the supposed drain caused by undocumented immigrants, they skillfully divert attention from the bill's true, devastating consequences. They've created a boogeyman, a convenient scapegoat to blame for the nation's ills. The story is not just about numbers or budgets. It's a full-blown psychological operation. It's about making you angry at the wrong people so you don't notice who is actually picking your pocket while you're busy looking the other way. And so, the stage is set. The enemy has been identified, the threat has been magnified, and the solution, H.R. 1, is presented as the only logical response. The bill's proponents can now portray themselves as fiscal hawks and guardians of American sovereignty, all while preparing to dismantle a system that millions of actual citizens rely on. The claim about 1.4 million immigrants is not just a talking point. It is the cornerstone of their entire argument. It's the key that unlocks the door to massive budget cuts, and it relies on one very important thing, that you won't look too closely at whether any of it is actually true. Now, let's do something truly radical in today's political climate. Let's look at the facts. Let's talk about what federal law actually says. Since 1996, with the passage of the Personal Responsibility and Work Opportunity Reconciliation Act, federal law has been crystal clear. Undocumented immigrants are explicitly barred from enrolling in most federal benefit programs, and that includes Medicaid. Let me repeat that because it seems to be a point that gets conveniently lost in the shouting. You cannot, as an undocumented person, simply walk into an office and sign up for full-scope federal Medicaid coverage. It is illegal. It has been illegal for nearly 30 years. There is, of course, a critical exception to this rule, and it's one born of basic human decency and practical hospital administration. The law allows for reimbursement for emergency medical services provided to undocumented immigrants. Think about what that means. It covers life or death situations, a catastrophic car accident, a sudden heart attack, a life-threatening complication during childbirth. This isn't for a routine checkup, a flu shot, or managing a chronic condition like diabetes. It's to ensure that a person doesn't die on the floor of an emergency room, and to prevent hospitals from going bankrupt from uncompensated, life-saving care they are legally and ethically obligated to provide. This is not a loophole. It's a policy of last resort. The MAGA narrative deliberately conflates this emergency-only provision with full-blown, comprehensive health insurance. They want you to believe that these are equivalent, that providing emergency care is the same as giving away a golden ticket to the entire American healthcare system. It's a fundamentally dishonest comparison. The system is designed to be a safety net for the most extreme circumstances, not a welcome mat for ongoing public assistance. The federal government does not fund primary care, dental visits, or prescription drugs for undocumented adults. The law is restrictive, it is specific, and it is nothing like the open-door free-for-all that H.R. 1 supporters want you to imagine. So, when politicians thunder on about ending the immigrant drain on Medicaid, what are they actually talking about? The federal program, as we've established, is already off limits. Their anger is therefore directed at one of two things: either the bare minimum emergency care that saves lives, or something else entirely. As we will see, their true target isn't a federal problem at all. It's a handful of state-level decisions that they want to punish. The grand national crisis they describe is a phantom, a ghost conjured from misinterpretations and outright lies about how the law currently functions. The foundation of their argument is built not on rock, but on quicksand. To understand the gap between rhetoric and reality, let's zoom in on a specific state, Colorado. If you listen to the national propaganda, you'd think Colorado is a sanctuary state handing out gold-plated insurance cards at the border. The truth, as is often the case, is far more limited and far less scandalous. Yes, Colorado is one of a small number of states that uses its own money, not federal dollars, to offer some health coverage to certain immigrants. But the key words here are some, certain, and its own money. This is not an open invitation for every undocumented person to get free health care for life. The programs are incredibly specific and narrowly targeted. So who actually gets coverage in Colorado? Pregnant people in undocumented families who meet the income eligibility requirements, and children in undocumented families who meet the income eligibility requirements. This policy recognizes a simple, compassionate, and fiscally smart reality. Providing prenatal care to a mother leads to healthier babies and fewer costly complications at birth. Similarly, ensuring a child can see a doctor for an ear infection or get their vaccinations prevents more serious illnesses and expensive emergency room visits down the line. Notice who isn't on that list: the vast majority of undocumented adults. A non-pregnant childless adult has no access to this state-funded program. This is the crisis that proponents of H.R. 1 are so incensed about. They are not targeting a federal failure. They are targeting a state's decision to use its own funds to provide basic preventative care to pregnant women and kids. H.R. 1 is designed to punish states like Colorado for making this choice. The bill threatens to withhold federal funding from states that dare to step up where the federal government has stepped back. It's a punitive measure, an attempt by the federal government to bully states into abandoning some of their most vulnerable residents, even when those states are footing the bill themselves. The political propaganda deliberately ignores these crucial details. It erases the distinction between federal and state funding. It erases the distinction between a child getting an asthma inhaler and an entire population receiving unlimited benefits. The narrative requires a villain, and the reality in Colorado just doesn't provide one. It provides a story of pragmatic, targeted public health policy aimed at mothers and children. But that story doesn't sell fear. It doesn't justify gutting a national program. So, the truth is twisted, the details are omitted, and a responsible state-level decision is rebranded as a national security threat. If the vast majority of undocumented immigrants aren't on Medicaid, how do they navigate the labyrinthine American healthcare system when they get sick? The answer is a world away from the lazy narrative of government dependency. The reality for most immigrant families in Colorado and across the country is a patchwork of cash payments, crippling debt, and a constant underlying fear of a medical emergency. They are not exploiting the system. In many ways, they are entirely outside of it, forced to pay their own way in a system that is already notoriously expensive for everyone. Talk to the people who actually live this reality. You'll hear stories of families setting aside cash from every paycheck just in case a child gets sick. You'll hear about people negotiating payment plans directly with hospitals, committing to years of monthly installments to cover the cost of a single procedure. Community health centers, which often operate on a sliding scale based on income, become vital lifelines, but even they are not free. Immigrants pay out of pocket for doctors' visits, for prescriptions, for dental work. They are active consumers in the healthcare marketplace, often paying more for the same services than those with insurance, because they lack the bargaining power of a large insurance provider. This lived experience stands in stark, brutal contrast to the political rhetoric. The image of the freeloader is a cruel fiction. These are people who work, pay taxes, including sales, property, and payroll taxes that contribute to the very systems they are barred from accessing, and do everything they can to avoid the healthcare system unless absolutely necessary. Many delay care for as long as possible, turning minor treatable issues into major, expensive emergencies. A persistent cough is ignored until it becomes pneumonia. A toothache is endured until it becomes a life-threatening abscess. This isn't a strategy of exploitation, it's a strategy of survival. The tension between the propaganda and this reality is where the true story lies. The political narrative needs a villain who is lazy, scheming, and a drain on society. The real people behind the label are working-class families trying to make ends meet, paying their bills, and contributing to their communities. They are not relying on government handouts. They are navigating a system that is, by design, hostile to them. The MAGA story is a ghost story meant to scare you. The real story is one of resilience, struggle, and a quiet determination to provide for one's family against overwhelming odds. The constant drumming narrative about immigrants draining public resources is not an accidental misstatement. It is a deliberate political strategy. It is the weaponization of fear. By painting a specific group of people, in this case undocumented immigrants, who are overwhelmingly people of color, as a dangerous, parasitic force, politicians create a powerful emotional lever. This lever can be used to justify policies that would otherwise be rejected as cruel or irrational. It works by activating our most primal instincts, to protect our tribe, to hoard our resources, and to fear the outsider. It's a tactic as old as politics itself. This strategy intentionally targets communities of color, creating and reinforcing deep-seated racial anxieties. The language used is often coded, but the message is clear. When politicians talk about illegals taking over, they are tapping into a long and ugly history of xenophobia and racism in America. They are building a narrative where hardworking, implicitly white citizens are having their pockets picked by undeserving, implicitly brown foreigners. This rhetoric is corrosive. It tears at the very fabric of our communities, pitting neighbor against neighbor and fostering an environment of suspicion, resentment, and hostility. It turns human beings into political symbols, stripping them of their individuality and humanity. The ultimate goal of this fear-mongering is to provide cover for a radical political agenda. In the case of H.R. 1, the immigrant scapegoat serves as the perfect justification for dismantling Medicaid. The public is told the cuts are about fiscal responsibility and immigration enforcement, not about taking health care away from the poor, the elderly, and the disabled. It's a classic bait and switch. The fear of the other is used to distract from the harm being done to us. The anger directed at a small, marginalized group provides the political capital needed to enact massive, unpopular changes that affect the entire country. This isn't just about policy, it's about power. By inflaming division, politicians can consolidate their base, turning elections into cultural crusades rather than debates about governance. The immigrant becomes a convenient enemy, a focal point for all the economic anxieties and social frustrations of the electorate. Lost your job? Blame the immigrants. Is your local hospital struggling? Blame the immigrants. This deflects blame from the real sources of these problems, be it corporate greed, systemic inequality, or failed government policy, and channels it toward a group with little political power to fight back. It is a cynical, destructive, and deeply effective political tool. So let's get back to that magic number 1.4 million. It's the number that launched 1,000 press releases and justified $1 trillion in cuts. Proponents of H.R. 1 claim this is the number of undocumented immigrants on Medicaid that their bill will remove. But as we've seen, this is a masterful piece of deception. Federal law already bars undocumented immigrants from regular Medicaid. So where on earth does this number come from? It comes from twisting the facts until they scream. The 1.4 million figure does not, and has never, referred to people illegally enrolled in the federal Medicaid program. Here is the sleight of hand. The number actually refers to an estimate of individuals who would lose coverage from state-funded programs if H.R. 1 were to pass. Remember those programs in states like Colorado, the ones that use their own money to cover children and pregnant women? H.R. 1 is designed to make those programs untenable by penalizing the states that run them. So, the bill isn't removing illegal recipients from a federal program. It is coercing states into dropping legal recipients from their own state-level programs. It's a threat, not a cleanup operation. It's like claiming you're cleaning your neighbor's house by threatening to burn it down if they don't. This deliberate misrepresentation is the heart of the fraud. The narrative sells you a story about cracking down on illegal immigration and federal waste. The policy actually delivers a punishment to states for legally providing health care to some of the most vulnerable people within their borders. Only a handful of states, 14 plus the District of Columbia, even offer this kind of state-funded coverage. We are talking about programs that are limited, targeted, and paid for by the states themselves. To present this as a widespread national crisis of federal fraud is a lie, plain and simple. It's propaganda in its purest form. The gap between what is claimed and what is true is staggering. The claim is about stopping a massive illegal drain on federal coffers. The reality is about forcing states to abandon their own commitments to children's health. The 1.4 million figure is not evidence of a problem. It is a projection of the harm the bill itself will cause. They are citing the body count of their own policy as justification for the policy itself. It is a breathtakingly circular and cynical argument, one that relies entirely on the hope that no one will check the fine print and discover the truth behind the headline number. While the entire debate has been framed around a phantom menace of 1.4 million immigrants, the real catastrophic impact of H.R. 1 has been quietly ignored. This bill is not a surgical strike on immigration fraud. It is a carpet bomb aimed at the entire American healthcare system. According to the nonpartisan Congressional Budget Office, the Senate version of H.R. 1 will cause 11.8 million Americans to lose their health insurance. Let that number sink in. 11.8 million. The vast majority of these people are not undocumented immigrants. They are United States citizens. They are your neighbors, your friends, and your family members. The bill achieves this devastation through a brutal, multi-pronged attack. It slashes over $1 trillion from federal Medicaid and CHIP funding over the next decade, the largest cut ever proposed by Congress. These cuts will force states to make impossible choices. They will have to drastically shrink who is eligible for Medicaid, cut the benefits that are offered, or reduce payments to doctors and hospitals to unsustainable levels. This will impact low-income children, seniors in nursing homes, people with disabilities, and working-class adults who rely on the program to stay healthy and afloat. The focus on immigrants is a smokescreen for a wholesale assault on America's social safety net. The damage won't stop with those who lose their coverage directly. The American Hospital Association has warned that these cuts will trigger a cascade of failures throughout the healthcare system. Hospitals, especially in rural and underserved communities, will face a surge in uncompensated care, pushing them to the brink of collapse. This means facility closures, longer wait times, and the elimination of essential services like maternity wards and mental health clinics. Even if you have private insurance, you will feel the effects when your local hospital is forced to cut staff or when the nearest emergency room is an hour farther away. This is the hidden truth of H.R. 1. The story sold to the public is a lie. The bill was never about protecting Medicaid from a handful of immigrants. It was always about gutting Medicaid for millions of Americans. The 1.4 million figure was the excuse, the justification needed to push through a deeply unpopular ideological goal. The real targets were never the undocumented. The real targets were the poor, the elderly, the sick, and the vulnerable, the very people Medicaid was created to protect. The architects of this bill are using one vulnerable group as a weapon against another. So we have to ask the most important question in politics. Cui bono? Who benefits? If H.R. 1 is not really about stopping immigrant fraud and is guaranteed to strip healthcare from nearly 12 million American citizens, why is it being pushed so aggressively? The answer lies in the very structure of the bill. The massive trillion-dollar cuts to Medicaid and other social programs like SNAP are not happening in a vacuum. They are designed to offset other priorities. This is not about saving money or reducing the national debt. It's about reallocating it. It is a massive transfer of wealth disguised as fiscal policy. The division sown by the anti-immigrant rhetoric serves as the perfect distraction. While the public is encouraged to argue about who deserves healthcare, the real debate is being sidestepped. The conversation we should be having is about why we need to cut $1 trillion from healthcare for the poor in the first place. Is it to fund massive tax breaks for corporations and the wealthiest Americans? Is it to finance other ideological projects that would be impossible to pay for otherwise? The scapegoating of immigrants prevents these uncomfortable questions from ever being asked in the mainstream discourse. It keeps the public's eyes fixed on the magician's left hand, while the right hand makes off with the money. The beneficiaries are, therefore, twofold. First, the politicians who use this division as a tool to gain and hold power. They energize their base with fear and outrage, creating a loyal following that is immune to facts and reason. They can ride this wave of resentment all the way to the ballot box, all while avoiding accountability for the real-world consequences of their policies. They profit politically from the chaos they create. Second, the wealthy and corporate interests who stand to gain financially from the bill's other provisions. The cuts to social programs are the price that ordinary Americans are forced to pay for their benefactors' rewards. This is why the narrative is so crucial. Without the story of the immigrant boogeyman, the policy falls apart under scrutiny. It would be exposed for what it is, a cruel and cynical plan to take from the many to give to a select few. The division is not an unfortunate byproduct of the policy. It is essential to its success. It is the anesthetic that numbs the public to the pain of the surgery being performed. The goal is to keep us fighting amongst ourselves, so we never look up and see who is truly benefiting from our collective misery. We stand at a critical juncture with a bill passed by the Senate on a tie-breaking vote now heading back to the House under immense pressure for a final vote by July 4th. The air is thick with propaganda, a fog of fear and misinformation designed to obscure the truth. The story of H.R. 1 has been sold as a righteous crusade to protect American resources from 1.4 million undocumented criminals. But we have pulled back the curtain. We have seen that this number is a lie, a distortion of state-level programs that legally provide care to children and pregnant women. We have seen that federal law already blocks what they claim to be stopping. The real story of H.R. 1 is not about immigrants. It is about the 11.8 million American citizens who stand to lose their health care. It is about the rural hospitals that will be forced to close their doors. It is about the seniors who may lose their nursing home care and the children who may lose access to a doctor. The immigrant is simply the scapegoat, the convenient excuse used to justify a policy of breathtaking cruelty. The right-wing propaganda machine has built a narrative of fear to sell a product of devastation, and the victims are not just the immigrants they demonize, but the American public they claim to protect. It is time to challenge this narrative head-on. We must reject the politics of fear and division. We must refuse to be distracted by the scapegoats they offer us. The question is not whether an immigrant child in Colorado deserves state-funded prenatal care. The real question is why a political party is willing to dismantle the nation's healthcare safety net, harming millions of its own citizens in the process. Who profits when we are at each other's throats? Who loses when fear, not compassion or common sense, dictates our national health policy? The choice before us is clear. We can fall for the oldest trick in the book, blaming a vulnerable minority for problems they did not create. Or we can look beyond the smoke and mirrors and confront the real threat. The threat is not a family seeking a better life. The threat is a political agenda that sees healthcare no longer as a human right. It's now a budget item to be slashed to fund other priorities. We must demand accountability. We must ask the hard questions. And we must see H.R. 1 beyond what its proponents say it is, and say what it truly is, a devastating attack on the health and well-being of the American people.